Welcome to my channel, Acheno Ogola the lawyer, and today is Mentorship Wednesday, and with me here I have a guest who's a nutritionist and a dietitian, and he's called Eric Ngereso, and he's going to be telling us more about our nutritional needs and what we should do in terms of diet and our health needs. Thank you for agreeing to host my channel today, and you're very much welcome. Yes, so before we proceed with the questions, I'd like you to give us a bio about yourself, who you are, what you've studied, and how you've been able to be a nutritionist and a dietitian.
Okay, thank you very much for hosting me this day. Well, my name's Ngereso Eric Kihugwa, trained dietitian or nutritionist. Well, schooled at Egerton University, Njoro. And upon graduation, I've been in the field for the past 11 years, serving patients presenting with various needs across the human lifespan, right from the young till to the old age. Now, to be in the field, of course, there has to be training with the recognized organizations or institutions, be it polytechnics or colleges or even a university. So, as I said earlier, I was from Egerton Joro, and so far 11 years in the industry. Now, I have had a bias towards management of non-communicable diseases, talk of diabetes, cancer, hypertension related, among the patients whom I see. They form a bigger cluster of the patients I tend to attend to.
Okay, thank you so much. Thank you so much for elaborating who you are. And also now, as we move into our discussion, maybe you could explain to us what nutrition and dietetics is all about.
Well, nutrition is like a process of establishing the needs of an individual against prescribed standards. So like in this context would be in terms of say you can use baselines like say his or her weight, and then you measure it against the standard for a person who is considered to be ideal. Now, so when you do those assessments, you're able to establish status against cutoff indices. The predominant option is say the body mass index, which will now highlight the weight and height relationship of a person, therefore determine their nutritional well-being or status. Now, when it comes to dietetics or dietitian aspect of it, is now translating knowledge concerning food into addressing the identified nutritional need in the individual person or community. Yes, yeah.
And now, what are some of the qualifications that one needs to practice as a nutritionist or dietitian in Kenya?
Well, at first, there are various qualifications. You either upon joining college, middle level, or maybe even university nowadays, you could actually have a certificate with a baseline minimum of 6-month training in that. But also there are diploma qualifications, which now may also now authenticate you to be in the field. But also besides that, also there is the aspect of a degree training, master's or even PhD. So depending on how far you'd want to go, the sky is still open.
Okay. And then is there an association that governs or regulates nutritionists in Kenya?
Yes, there is what is referred to as the Kenya Nutritionists and Dietitians Institute.
Okay.
An organization now that has the mandate of training, licensing, and even registering nutritionists, so that more or less to bring some element of sanity in the industry. Because formerly, before then, usually anybody would pop up and say he or she is a nutritionist, but with the need through the Act of Parliament, then the institution was established to be able now to regulate the sector. Sure.
Thank you For making that clear, because many people are still claiming to be nutritionists and they're not registered. So in case someone is not registered, it means they're not licensed to practice. Okay. And then now, what are some of the opportunities available in the field of nutrition and dietetics?
Well, upon graduation, there are a raft of options. That one, you would either be in the food industry, where now, like say, you've seen in the supermarkets, there is labeling on every possible consumable food item on the nutritional content or nutritional value. So that is an area where one would actually venture in. So that now they more or less like present as food scientists, though with a nutritional backing or background. So now they're able to explain to the consumer on what the contents they are in, so that now they could do informed purchasing or buying. But also in the research field also, there is also an opportunity there. So it also depends on the internal drive in the individual on whatever interest he or she has. So we'd also pursue research, because you see now modern healthcare requires evidence-based interventions, and therefore as a nutritionist also you would also venture there to bring about solutions that are actually evidence-based to inform practice. And then academia, one also would venture into teaching, be it at the colleges, universities, or related institutions. And then also hospitals, where now you would actually now be, to be biased towards now handling patients, now what we may call clinical nutrition, where now that's where now you're dealing with disease management. In the community, there is community nutrition, whereby now it's you do community triage or surveillance, so that now you establish needs to inform public policy in terms of interventions that will need to come in. But also, you would also do private practice. Yeah, so the industry is too broad. It's also now any person in the field, it's him or her to decide on which niche would he or she want to venture in to see them make an impact. Sure.
I believe also sportsmen need nutrition.
Oh yes, that's an area I was forgetting. Yeah, so even sports nutrition is an area of interest also.
Wow. So there is a wide area for someone to practice. I didn't know the rest, but now I'm glad I know, and I'm glad now the viewers will be able to know, because I think for some reason some people who graduate from nutrition and dietetics really don't know where to start from.
Very true.
Yes. Have you encountered such challenges, I mean, with young people?
Well, not necessarily young people, but even personally, at start I didn't know where exactly I was going. But luckily enough, say in the first year, I was able to be attached to a facility, hospital to be specific. So I more or less now had the interest on job. I knew what the need was, so the direction was nearly defined. Okay. So it's real that majority, in as much as they start, they have no clear understanding of the direction. And I think maybe to dilute that, it would require that at the time of maybe orientation in colleges or whatever institutions, they need to have a primary service provider who is in the field to more or less come and maybe shed light, so that now people could also walk through the journey with the know-how. Sure.
For sure, that's really insightful, and I hope someone will take up that information and do the same, so that people are not lost.
Sure.
Or they don't know what they are doing with their courses that they are doing. Okay, so now moving on to the type of people. You said mostly you've handled cancer patients, diabetes. So maybe you could explain to us the various age groups and the various maybe nutritional needs, or also the patients you've handled. What is the thing that cuts across them?
Okay.
Yeah.
Well, you realize that even beside, in the absence of disease, usually say that's now what you may call nutrition through the life cycle. You realize that there are essential nutrients necessary to realize optimal health. That's why now there is nutrition in pediatrics, where now you are looking at the critical nutrient needs to see optimal development and growth of these children. Now, during the teenhood or even now adolescence and related stages, you realize that there are critical nutrients, like say maybe iron in adolescent, especially now from the context of girls, where now nutrition becomes also essential to realize now on the restoration of enough reserves to also optimize performance. Now, during, like say, old age, usually they also present with their own challenges in terms of maybe because of their physical incapacities, financial constraints, or related, they may tend not to access what is desired to define optimal health. That's why, like say, if you are to link it to the current, like say, COVID context, they were the at-risk group because you see now they have vulnerabilities secondary to inadequate nutrient intake that also predisposes them to disease exposure. Index yao inakuwa juu. Yeah, so in that regard now you'll find that in each cycle through the journey they have a fitting requirement which has to be addressed by the nutritionist. Now for disease specific context, you realize that, like say, in the event of cancer, there are challenges that also present with the treatment, and therefore of critical interest to the nutritionist is helping address the presenting challenges during treatment, talk of maybe nausea, vomiting, diarrhea, or related concerns. So you come in as a nutritionist to help now arrest or address, give alternatives on how to bypass the challenge. But also you realize that wasting or weight loss is a common problem among those patient populations, and therefore you come up with plans or regimens to be able to counter the effect. Now, on top of diabetes matters, weight loss, maybe weight loss, glucose control becomes a priority to the nutritionist. The rest also applies also to to hypertension and even other non-communicable diseases. Yes.
So I remember you were mentioning that even nutritional needs begin even at the time of conception.
Yes.
So expectant mothers should be able to understand the nutritional needs of the baby they are carrying, right?
It should be before even they conceive. They should also establish what is their status, so that now to determine whether they have enough also to share to the unborn child. You see now, if you are to conceive minus having, being undernourished, obviously you won't share enough, and therefore you're likely to like give birth to a child who is either premature or maybe as in small for age, depending, because you didn't have enough reserves also to share to the baby while still in the womb. So that explains now the aspects of episodes of stunting, wasting that now manifests after. Yes, or maybe abnormalities that present, like say spina bifida, whereby a child has a problem with the back, with the neuro channel, and therefore they may be of short stature at the time of birth.
So shortness is related.
Well, not really shortness independently, but as in like the neurotube effect is like you've had children of hydrocephalus, like say they have a bigger head.
Bigger head than the rest of the body.
Therefore, they need to be like drained some fluid there.
Yes.
That's not the neurotube effect. Now,
okay.
basically, a mineral or rather a vitamin of interest was lacking from the mother, and therefore they wouldn't be able now to generate enough to the baby, and therefore, of course, now seeing the resultant outcome. That basically that is folate deficiency. Yes. That's why, like, for those who go for clinics, antenatal clinics, they're given folate. They don't taste nicely, but you see now the repercussion beyond the taste here outweighs the taste interest that you wanted the tablet to taste better. Yeah.
Wow, I think that's something actually all ladies of childbearing age should be able to look into, because I don't think many people actually assess their bodies if they can be able to, handle a full-term pregnancy.
Sure.
And that's why maybe even complications arise later, right?
And even for those who are of a higher weight, conditions like say preeclampsia or maybe hypertension that arises in pregnancy also becomes a risk, and that's why even though not that necessarily you must be underweight to have those issues, even also being overweight also can have even diabetes related to pregnancy. So you need to now, once you are assessed, to know where you are, so that now you should be at where the right staging, and then you're able to prevent those complications long term.
Okay, so in your course of practice as a nutritionist, what are some of the best methods that you have seen are working for people who want to lose weight or who want to manage maybe some certain types of diseases, because what I'm saying cutting across, of course, is how you manage your lifestyle in terms of what you eat and if you really meet your nutritional needs.
Okay. Well, there are about 4 elements of interest that can see one successfully achieve the concern you put across.
Okay.
That is weight loss or even related disease management. Now, one of these is there has to be, and it actually takes up over 90% of the care.
Pardon?
90% of the success in whether weight loss or even disease management, 90% rests with the patient.
Okay.
And this 90% now is segregated into one, there has to be change in their diet.
Oh, okay.
If you don't change in the diet yet, now you are working on losing weight, you cannot graduate. Yeah, because see now, if you don't change the fueling mechanism of the body, yet you would want, like say, to purport as though you want to exercise. Yes, you'll exercise, but now replace back what you've just lost in the field. So which means now, in the context of diet, you're looking at you change what you buy, how you cook it, how much you serve at a sitting, and also how often you need to eat. So those 4 segments under diet will see you, achieve the goal. Now, the second element is discipline, because you see now you can't be policed to execute any of the listed items I've put there. Yeah, so in this case, understand that it's your responsibility. Otherwise, if you delegate the system, then now you are just opening ground for the growth of the pharma industry, because now they exploit on your weakness.
Yeah.
Now, the third element is exercise, meaning now you need to burn what you've already stored. Yeah, so you cannot say now you just now exercise and now don't change your diet, or you change your diet and don't exercise. They must go hand in hand. Yeah, so but also to execute the exercise successfully, equally it calls for discipline. So they are more or less like interrelated.
Yeah.
And then the last aspect of it is family support. So that now, like what I tell patients is, let me not see your friends or relatives demonstrating solidarity at the bedside in the ward, yet they were not showing the solidarity on the field. Yeah, so take up family support seriously to realize the objective of interest.
Wow. Wow, that is really insightful, because for me sometimes I think it's maybe just exercise only, but then I still eat the carbs. But as you've said, they have to work hand in hand.
True.
Okay, so what has been your experience collaborating maybe with physicians? Because I know as a nutrition, you can't work in isolation, right? So maybe what is your experience in collaborating with physicians?
Well, it is 50-50. 50-50 to mean there is the first 50, there are those who would want to cleave onto the patient. Now, basically it is out of selfish interest. As in, you see, if a patient performs poorly, obviously it means more revenue will come their way.
Performs poorly in terms of?
Like, let me give you the example. Maybe say if you are a diabetic patient who is not educated right on your diet to address the blood sugars, usually you'll have more clinic reviews to the physician, and therefore now more consultation charges heading there.
Could it's true that some doctors actually don't give you information so that you can keep going to them?
No, it depends on the driver. The driver in terms of, like, for instance, if it's like now you want to appear the tall figure in the health of a person, yet you're not addressing their need. Yeah, so if the driver, you're in an affluent society, so if you want also to catch up with your peers in the field, you see, you are likely to compromise on quality of care to meet your ego. Now, that is part of the 50%. But now, the other 50, yes, if they understand the patient treatment protocols correctly, then there are those who will actually now, like what is established in HIV care. So you can't see a clinician before you had a session with a nutritionist. And even now, like say in some centers, there is also a good programming, like say in diabetes, whereby now the nutritionist also has to be on course to realize near good success. So, but the first 50, where now there is the commercial interest, usually those who are in the aspect of private practice. You see now also, how do you sustain your practice if the clientele don't come?
Yeah.
So, but you see, the unfortunate is it's at the disadvantage of the client. Now, so for those who know the protocols correctly, usually yes, the rapport is good.
Wow.
However, generally 1 in 10 will refer, but the others, you've understood what I've mentioned.
Yes, yes.
That's the core issue.
I've totally understood. I think I'm enlightened because many diseases right now are lifestyle, which can be managed by managing your nutritional needs. But you see, the healthcare system, especially for those in the private practice, enriching themselves out of patients. So I hope people are learning for themselves.
And the unfortunate to it is, like say in the context of where I work, when you are to look at this patient, possibly before their diagnosis ended up demonstrating complications, they must have been seeing somebody privately. And you see also is the customers who also encourage such kind of behavior. As in they don't have time for themselves. And you see, time for yourself means when you visit a facility, like say a public facility, yes, there will be delays, but there is information.
Okay.
But now that's why they would rather rush to where they would be seen very fast, and therefore they also walk out with their errors and also sustain the same problem across.
Wow.
Yeah, so it's until also public sensitization on what is needed for them. But also another area of interest also would be the fear of the perceived don'ts. They fear that now if you go to a nutritionist, I will be told don't do this, what is perceived good to them. Yeah, so they would rather hang on to their comfort zones at the detriment of their health.
Yeah, for sure. I mean, people are afraid of being told don't take pizza, don't take French fries, rather than clinging on to what is the best for their health.
Sure.
Okay, wow, that's I'm really getting enlightened, and I thank you for coming today. And again, what will be advice to especially parents who have young children right now, because right now there is so many processed foods. Like what is your advice in terms of eating whole grain, natural food as opposed to processed foods?
Well, whole grain is the way to go.
Okay.
And I assume, not to assume, but rather believe, even most of those parents lived in that age or generation. But now, because they've had the opportunity now to be exposed, they are perceiving what was normal to them is now abnormal in this day and time. So usually, children learn from home. So one would say my child doesn't like maybe veggies or related maybe grade 2 portion meal flour, but it's because in your house they found you doing pembe, for example. But now to make a radical shift, just serve what you know is right for your children, and you'll have it easy for your pension even tomorrow. You see now, because it wouldn't make sense now you've retired, but also you have to cater for your medical expenses for your own self, but also for the child, because also he has maybe a communicable disease that also requires your input. So family, make those changes as a parent for the sake of your pocket, but also for the health of this child. Otherwise, even to do poverty eradication, that's the way to start. Otherwise, for instance, if I'm diagnosed hypertensive, then also my son or daughter also has the same condition, it means even if they were to get employment, they have a new cost item on their bill, that is prescription to address their needs. Now, with the presenting complications that come about those conditions, it means you can actually shrink all your fortunes to treat your health. So basically, as in, whole grain is the way to go. However ugly it may seem to look, but that's the life one has to pursue.
So actually, from the time of weaning, children should be introduced to natural foods as opposed to processed foods.
That's the message.
Okay.
Unless for occasions, if you are to visit somewhere where you had no control over their shopping, but of course by understanding that it's just a one-time thing, no problem. But as in, where you have total control in-house, do what is right for your house.
Okay. And then also there's now the issue of meat. I know meat is something that has been discussed a lot, and especially there was a time there was a lot of exposés about how we are eating meat that maybe is donkey's meat, dog meat. What will be your comment about the amount of meat or the types of meat that actually people should be taking?
Well, that's a hot area in terms of two things. One, the commercial interest
Oh.
vis-a-vis the health benefit.
Okay.
So on the commercial arm, more or less, that's now when the aspect of man eat man society sets in. Yeah, you see now, ingenuity in the commercial sector is what is now provoking the discussion at hand. As in, people would want to reap profits even from unethical sources, and that's why if there is some element of ethics that has to prevail in the business environment, then we wouldn't be bothered about the meat industry. Now, but also on the other end, on the health benefit from the same, usually also people, even if yes, the risk would be smaller, but now we tend to be more carnivores, yet we are herbivores.
Oh, by
Humans.
nature we
By
are
nature we are
herbivore.
herbivores.
Okay.
Even no wonder even nature is green, so that now we may more or less do more herbs than the meats.
Yeah,
Okay,
sure.
but you see now some element of greed also sets into ourselves. So now we also want to more or less appear as though we are in a rat race to outdo each other in meat consumption, which also now also provokes the need for commercial injection of whatever unethical alternatives to satisfy our hunger. So ideally, the healthy way to do is identify the source, know the source. There are established source alternatives that can be pursued, and then once you know the source, now to minimize risk, then limit how often you have exposure to the meat itself. Now, even if you are to buy, then now buy the lean cuts, the steak, not even the ribs or related. You see those ones, they are percolated fat. They taste also. Nyama choma usually is ribs in stature. So once the fat roasts, it invites you because of that smell. Yeah, but you see, ideally the steak can be the best way to go, and then now minimize exposure to not more than 3 times a week, while also controlling the portion you serve at a city. So now, even if there could be some unethical practice outside, the dose exposed to will be much smaller than if you had to make it a routine daily entity. Yes.
So it means that those who eat meat in every meal, they are more exposed to certain types of diseases.
Not diseases, as in harmful chemical preserves involved, like say the expose that was. But even there are, and it doesn't mean now once the expose was done, now that has stopped.
Yeah, for sure.
Yeah, you see, we live in a society where people forget too soon.
Yeah, forget.
And now with the poor control mechanisms in place to just ensure safety, then it means also it's easier to have a relapse of the same. So issues of concern now, the chemical preserves involved now would easily predispose somebody, like say, to some forms of cancer, for example, which now of course is also a burden in the country and even the globally at large. Yeah, sure.
Wow. I hope people will actually understand that we are born herbivores and not carnivores.
Yeah, that's an adapted character.
Okay. So even as you're winding up, you said you've worked with various age groups of people and various types of people who have various nutritional needs. Maybe as you close, what will be your advice to the various age groups so that people can ensure that they have the best nutrition and they live optimally? Yes.
Well, I think I wouldn't go any further than what was earlier on put across by Hippocrates, who said that let food be thy medicine, and let thy medicine be thy food.
Wow.
So that is to mean to be able to prevent much of the health concerns presenting globally, even as a country, we need to make drastic changes at our kitchen. Now that comes with some amount of discipline, But then now also, even the motivation behind UHC is actually to push responsibility to the citizen, ya kwamba now he or she takes responsibility in making rightful choices pertaining to food, so that now they're able now to do it to prevent disease.
Okay.
Yes.
And there's a question I think I had forgotten to ask, but now I've remembered. It's about like, how do you evaluate a client's nutritional needs? What standards do you use to evaluate what a client needs?
Okay. Well, when you come into contact with a patient or a client, usually there is what you call the initial care process. Now, it is 4-staged, whereby now, for instance, the first stage, which involves nutrition assessment, you now could do anthropometry, like what is now body mass index, is one of the indices of interest, whereby now you can be able to evaluate their weight vis-a-vis their height. So now you're able to classify them as either overweight or obese or underweight. But also, besides that, also there is a biochemical assessment, whereby now you do also look at their biochemical data, maybe from lab results. So that now you're able to, given cutoffs listed, which one fits best. Now also it informs your education on what has to be addressed. It is also clinical assessment, where now you just look at, you observe a client and get to see any forms of deficiency, signs or symptoms presenting, that now informs part of the intervention you put across. But then also now from their diet history, which is also another assessment methodology, you're able now to get to know from what he or she has put across based on their description, what are their possible likely needs or risks they are exposed to, and therefore informing your intervention.
Okay. And then do you also create meal plans for clients?
Yeah, our meal plan now is part of the intervention you'll put across after now you've counseled.
Okay.
So now you do the counseling education in the respective context, and then now you design a meal plan that now suits to address the identified need.
Okay. Thank you so much for gracing my show today, and I hope people have been blessed and now know the kind of nutrition that they need, and that they will seek professional help when it comes to nutrition. Thank you so much, Eric.
You're most welcome.
Okay.